Ciao e bentornati. Welcome back to Richard Harris's Herbal Tutorials, the tutorials that inform and educate about the practical and common sense usage of herbs and natural substances. The tutorials that teach you how to identify and use plants and other medicinal agents, when to use them and when not to. Also, the dosages and side effects are listed for your perusal. I'm Richard Harris, a Chinese trained practitioner of traditional Chinese medicine for over 30 years. I also practice Ayurveda, and I'm also a certified practitioner of Hirudotherapy. I would say this qualifies me a little to have a little know-how about these things. Don't you think so? With that in mind, I shall take this opportunity to share with you a little of the know-how that I have accumulated over the numerous years I have been practicing these two disciplines, and why I think that my little know-how is relevant at this moment. Most of the information given in my videos are sourced mainly from Chinese and Indian ancient pharmacopoeias. Together with my own clinical experiences, I have used these materia medicas because these two systems of traditional medicine existed for thousands of years and have an extensive and dependable medical system based on sound theoretical concepts and practical usage of herbs and other substances. There are no other systems of natural medicine that comes close. As such, I think most of us can only benefit from the vast medical knowledge left by the sages of these two ancient but modern medical systems. If you're interested in fairy tales, hype, and magic, if you like acts of different persons waving several types of herbs before you and extolling their magical benefits, then you need to consider if you have logged on to the right channel. If, however, you take your health seriously, as I do, then don't touch that button. Keep watching. While you're doing so, put on your thinking caps, relax, and follow me as we embark on another herbal extravaganza, where the emphasis is on learning, as you will come to understand as this video unfolds. I had always planned to do a video on the herb duck flower. I had decided to do this video whenever I was ready to do a video on the category of herbs known as cathartico-diuretic, the category under which this herb is classified. Disappointingly, I have been looking with dismay, disappointment, and a sense of sadness at the recent uploads of this herb by many persons. The uploaders not seeming to have any knowledge or care about its toxicity or its capability to cause harm. Most people tend to think because something is natural, it's harmless. Here is where I humbly think the little know-how I have gained over the years may be useful, and that is why this video about this herb at this time. Before we proceed, I need to remind you that the contents of this podcast is strictly for educational purposes and should not be interpreted as medical advice. If you think you need medical direction, please consult your physician or your healthcare provider for such. Also, if you're enjoying the contents of this video and you're learning new things, please take the time to subscribe if you haven't done so as yet. While you're doing so, please remember to give it a like, share with interested ones, and remember to leave your comments in the comment section. I'll reply as soon as I can. That being said, Let's continue on our herbal safari of exploring and learning about duck flower. Duck flower falls under the category catharticodiuretic. What are catharticodiuretics? These are drastic purgatives. Drastic, a special type of laxative. They are mainly indicated when there's constipation and fluids remaining in the intestine. These types of purgatives are extremely drastic. Repetition for emphasis. They cause violent diarrhea in the process, discharging large amounts of water with the stool. They're indicated mainly when there's ascites. Their violent actions is due to their toxicity. Therefore, caution must be exercised when using them. Special attention must be placed on their dosage and their contraindications. I repeat, caution. As I said before, when watching these videos, one must pay attention to the categories under which the agent or the herb is discussed. This is the guidelines that indicate whether your condition necessitates you using this particular agent discussed and whether the agent used matches the symptomatology presented. It's not one size fits all. There must be theory and practice guiding the diagnosis and selection of any medication. Failure to be theoretically and practically guided is counterproductive and reckless. For example, a woman who loses a lot of blood after childbirth is deficient in blood and somewhat anemic, according to Western medical practice. She will likely feel weak, a little chilled, with some blurred vision and dryness of the mouth. If she's constipated, this is likely due to anemia and there's not enough blood to moisten the stools, or she may even lack the energy to void the stool. Are you here with me? Do you follow what I'm saying? Are you recognizing there's theory and there's common sense? Okay, then using any type of drastic purge like duck flower is counterproductive and tantamount to malpractice. The principle of treatment is to facilitate bowel movement by nourishing the blood of that woman and moistening the stool with agents that supplement blood, such as molasses. This may be used alone or with other agents that possess blood nourishing capabilities. Here the diagnosis harmonizes with the treatment. Isn't this approach a common sense one? Doesn't this principle sound better than someone waving herbs like a flag and stating, if you're constipated, use this plant? So back to our topic of discussion, the duck flower, also called pelican flower and carrion flower. The last name being due to the terrible odor this flower exudes and which makes it attractive to flies. It is botanically known as Aristolochia grandiflora of the Aristolochiae family. The whole plant is used medicinally, but mostly the flowers. Its chemical constituents are sterols, coumarins, alkaloids, terpenoids, flavonoids including quercetin, rutin, kaempferol, and aristolochic acid, from which it derives its toxicity. This is a well-known nephrotoxin which can cause renal fibrosis, and linalool, which gives the flower its peculiar aroma. Duck flower is thought of as entering the organs and meridians of the large intestines and stomach. Its functions are 1. To transform water and reduce edema. 2. To expel phlegm and congested fluids. 3. To invigorate blood and reduce pain. Uses: 1. Ascites. With severe swelling and difficult urination, duck flower is used alone or with herbs of similar quality. This is one of the most common reasons for which it is used, hardly used for anything else. 2. Asthma due to congested fluids obstructing the lungs, with symptoms of wheezing and a sensation of fullness in the chest, with large amounts of watery sputum, used with radish seeds. 3. Sores and abscesses that are hot and painful. Macerate with parsley and applied topically. 4. Dysmenorrhea manifesting as lower abdominal pains and distension, especially if there's constipation. Use with nutgrass and mother's wort. The vines make a useful application externally for wounds, gouty swelling, and snake bites. Dosage: 0.5 to 1.5 grams. Contraindication: avoid using during pregnancy or while nursing. Also avoid giving to children and the elderly. Avoid if there's renal dysfunction. In America, the duck flower is considered as a known carcinogenic, and it is practically banned by the FDA. Finally, we have come to the end of another of our herbal and natural substances extravaganza. I have said a lot. I sincerely hope you all have learned a lot, or even a little. Really, it doesn't matter, just as long as you learned something. In this podcast, I've mentioned a few other herbs that can be used with the duck flower to address certain medical issues. I've listed the herbs separately, both their botanical names and vernaculars, for easy identification. They will follow soon. I had fun doing this podcast. I hope you did too. Unfortunately, all good things come to an end. But don't despair. Don't beat up, according to your Nalin, for I shall be back soon, Jehovah's willing, with more thought-provoking and enlightening videos. Ciao ciao. Fine alla prossima volta. Meaning, bye bye. Until the next time.